Lewis Thomas, called clinical medicine the youngest science, and in many ways it is. Systematic observation has been used by healthcare practitioners with inquiring minds for centuries, but the use of resembling formal quantitative methods has been a rarity. As a simple illustration, what may well be the most influential textbook ever printed on medicine was written by a Canadian, Sir William Osler. The first edition of Osler's textbook was published in 1892. It was a bracing review of how little was known about most diseases and how to treat them. That accounted for its influence, given the credulity of the times. But his skepticism was largely based on qualitative methods. So happens that Osler's peak period of professional activity, the years bridging the late 19th and early 20th centuries, was also a time in which applied statistics was flourishing. Two British polymaths, Francis Galton and his protege Carl Pearson, made huge contributions. Both were animated by the emerging field of genetics, and both dabbled, alas, in eugenics. But the statistical toolkit they created was very well suited to clinical research. As it happens, that toolkit found limited uptake in clinical research between the two world wars, but in contrast, in the realm of public health and population-based epidemiology, there was no shortage of advances and practical applications. Mapping of life expectancy into life tables, population-level statistics on incidence and prevalence of diseases, outbreak tracing and statistical analyses of risk factors for the so-called diseases of civilization. All this and more brewed in those years. Now, soon enough, a few souls decided that the epidemiology of healthcare itself was almost as interesting as the epidemiology of disease. Many studies in the 1940s, not least in the prepaid health plans in the US, began using the observational methods of public health research and epidemiology to critically examine what doctors were doing. With improved computing power in the post-war period, came the assembly of ever larger data sets related to the administration of health services, and also to the payment of healthcare bills, whether through public plans or through private insurance. The potential of these sources caught the attention of a young nephrologist with public health training named John E. Wenberg. In a landmark publication in Science in 1973, Wenberg and Gittleson examined geographic variations in the delivery of medical care in the state of Vermont. And for the next 35 years, Jack Wenberg mapped variations within and across the states of America, and sometimes in comparison to other nations. Rates of surgical procedures and medical admissions, expenditures per capita, hospital costs, lengths of stay, relevant markers of disease incidence that might somehow alter the use of resources or procedures, supply of physicians, insurance status, you name it. Wenberg and his colleagues examined it and found puzzling variability. By 1996, Wenberg's team was able to publish a full atlas of healthcare in the US. It's a series that continues to this day. Sometime later, Richard Smith, editor emeritus of the British Medical Journal, wrote about that first atlas as follows. It is not wholly fanciful to compare the Dartmouth Atlas of Healthcare with On the Origin of Species. Both books resulted from a rigorous accumulation of data and fundamentally changed our worldview. Darwin's book showed our descent from apes. The atlas exploded the belief that medicine is based firmly on science.